Okay, so good evening, everyone. And my today's talk in next 15 to 20 minutes, we are going to talk about efficacy, safety, and quality of life, which is the more emphasis of today's talk for two pivotal trials, Rainbow and Regard, which are ramucirumab for advanced gastric or gastroesophageal adenocarcinomas. These are my disclaimers for today's talk. The slide content has been provided by the company. So we know about 1,000 patients were recruited in these two pivotal trials, around 600 for Rainbow and 350 for Regard. Rainbow was paclitaxel plus ramucirumab versus paclitaxel alone in the second line setting after first line failure of 5FU plus platinum based chemotherapy in advanced stomach cancer or gastroesophageal adenocarcinoma, while Regard was ramucirumab alone versus placebo for really the frail patients of advanced gastric cancer. Both of the trials had overall survival as their primary endpoint. Since last 7, 8 years, we've been rehearsing these two trials several number of times. But today we want to dwell on the safety part, means the toxicity part, and the quality of life, which is, I think, the essence of today's conference. So the Rainbow was a multi-institutional trial. India was not part of recruitment in this. However, India was part of the Regard, which was the second trial. And again, emphasizing the same, it was 1:1 randomization. And what we saw was 2.2 months overall survival advantage. And more importantly, at survival analysis, so at 1 year, instead of 30% patients being alive of stage 4 stomach cancer, you had 40% patients alive. So that is almost 33% more patients of advanced gastric cancer who would be alive if you were on ram tax versus tax alone. So these landmark analyses are a fair representation of such an aggressive disease, which is what I think, and one should not only focus on medians. Similarly, if progression-free survival was also improved by 1.5 months, 4.4 versus 2.9, and same thing, landmark analysis at 9 months. If you have 10% patients who are progression-free on Taxol, then you would have 22% of patients who would be progression-free. So almost double patients if you are on Ramtax. Now, why I keep mentioning about these landmark analysis, which is important for such aggressive disease, because that directly correlates with general improvement in quality of life. Objective response rate is something very important, again, for the aggressive subtype of tumors. So I'll give you two examples. Let's say you have patient of sarcoma and you have some lung metastasis here and there. Patient is completely ECOG-PS 0, no symptoms. You put them on chemo and you give them side effects of chemo. And then after 2 months, you scan them and you see the tumor has shrunk. Now, actually, that is a response, but that response has not translated into improvement in that patient's life, right? Now, on the other hand, if you have an aggressive cancer like stomach cancer or a pancreatic cancer, where the progression of the disease means that patient is weak, fragile, less eating, cachexia, vomiting. So they are already suffering from their disease. In this scenario, if you give a drug and improves the tumor or the tumor is shrinking, usually these overall response rates correlate with improvement in survival. That's a very important concept which I wanted to drive today for students, if anybody is listening today, that response rate do matter, especially for the aggressive subtypes. So what happened in Rainbow study, there was almost twice as many patients who had a tumor shrinkage compared to Taxol alone versus Ramtax. And this doubling came at what cost? So yes, there was more fatigue, there was more abdomen pain, there were more diarrhea, but you could see these are all in single digits, marked in yellow. Neutropenia was fairly high. 40% of patients had grade 3 neutropenia. But now we know with the advent of GCSF using for last 20 years, I don't think so anybody's worried about just plain neutropenia. The febrile neutropenia rates was exactly same, 3% in both arms. So if at the cost of neutropenia, I get to improve their quality of life. Yes, definitely, this is a combo which I may use in second line stomach cancer. So now, the paper which was presented as a poster was the global QOL scores. If you see, the brown dots are the dots on Taxol alone, and the horizontal line is the week. So at every given week, the patient's quality of life was declining if you are on Taxol, because of course the disease was progressing. But if you are on Ramtax, that's the blue line, at every given point, patient's quality mean scores were slightly better. In fact, statistically significant better if you are in this drug. Further suggesting the point which I was making, if you're going to have more responses in these aggressive tumors, you're more likely to turn them into improvement in quality of life. So Ramtax not only improves PFS, not only improves OS, but also makes patients feel better. Now, this is the regard which was monotherapy for patients who are not poor performance status, where we don't give any chemotherapy. Usually, best supportive care is the only treatment. So, this compared to placebo versus ramucirumab monotherapy, and India had a fair representation in recruitment in this study. And again, what you saw was improvement in overall survival, which was statistically significant by 1.4 months. You can see it is 1.4 to 2 months in both studies, which is consistent in all the real world evidences as well. And same thing with progression-free survival. Mind you, the response rate was not. So ramucirumab is a static drug, just like a bevacizumab. So giving them has no more responses as compared to placebo. But what it does is almost doubles your stable disease, and that is what the ramucirumab does: is keeps your disease in check and allows you to live a few more extra months with better quality of life. And to see that depicted in this picture. Uh, so in regard quality of life, if you see the right bottom part, improved plus stability. So patients whose quality was improved versus patients whose quality was maintained, that total number was better as compared to patients who were on placebo, further proving that this drug not only improves OS but also helps patients feel better. And by, I think for today's discussion, this slide is the most important. And whenever I discuss with my students, I tell them the same thing, that patients feel better for longer period of time in their journey of a battle of cancer if they were on Ramtax or Ram alone versus placebo. So the deterioration of performance status is longer, 5 months versus 2.4 months on placebo. So in summary, 1,000 patients, improvement in OS, yes. Improvement in PFS, yes. Grade 3 events, slightly more, but I think so is not offsetting the quality of life. No more patients were stopping because of the side effect, and slightly more deaths in ramucirumab plus Taxol versus ramucirumab alone. Uh, that is probably because of chemo component also. So with that, thank you very much, and I hand back to the organizers.